We went to Florida, Pensacola, Florida, with 3 kids, and it was a great vacation for the kids. I was miserable almost the whole time, just being out of my comfort zone in a rental house. It was a great house. It was lovely accommodations. Thank you, Mom, for that. My whole family was there, but I wasn't in my bed. We didn't have the crib for the baby. We didn't have the changing table for the baby. So it was just a lot of leaning over, picking up the baby who was a year old, trying to keep her from, killing herself on every sharp corner there was, or falling off of a balcony, or eating sand, or anything like that. When you have 3 young kids, it's there's some work involved. You never get to just sit down and relax unless they're taking a nap. So we went on vacation to Florida, and it got worse and worse. I had saved a prednisone that I had gotten from my primary care physician. I took that for the ride home from Florida, and it helped. I guess it alleviated the swelling of the herniation, and kind of helped me to get through driving back, from Florida for 4 or 5 hours. But after that, I went back to see Dr. Donner, told him my symptoms got worse. I went in, and I didn't even realize that I had significant weakness in my tricep, but they did a tricep test, I guess you would call it, hands-on visit, where they just kind of push on your arm and isolate the tricep. And my right hand tricep was much weaker than my left, and I'm right-handed. I play guitar. I used to throw the baseball, football pretty well. My right arm should have been significantly stronger than my left, and now if I take a dumbbell, I can barely lift a 10-pound dumbbell like this on my right arm, but on my left arm I can do it with no problem. So there's a significant weakness there. I would suspect that muscle that controls your shoulder blade probably has some atrophy at this point, just because it's been now almost 6 months. So anyways, upon that consultation to Dr. Donner's office, they could tell I had significant weakness in my tricep. I told them the prednisone seemed to help. They gave me a step-down packet of methylprednisolone, which is another steroid, with the intent of you get a big dose on day 1, and it weans you off of it over a 7-day period. After the first 3 days, I saw no relief. I called him and said, look, this ain't working. It's only going to get worse from here as I take less and less of the steroids. So I went back in for another visit, they actually, no, I didn't go in for another visit. They scheduled me for an MRI, a second MRI, because the first MRI wasn't terrible. It didn't look like there was terrible disc degeneration, but it was something that they wanted to try conservative treatment for. The second MRI I went to, I should say the first MRI that I did, it was very comfortable. I had some numbness in my arm, but no pain. And I could lay there in the MRI machine. I think I fell asleep. I'm not claustrophobic, so that's nice. I went back for the second MRI, and it was the most painful 20 minutes of my life, I think. While I was going through that MRI, I was just activating that nerve at 100%, it felt like, as far as the pain level goes. And I was literally digging my thumb into my first finger here the whole time, just to try to take my mind, my thumb fingernail, I was digging it into my skin just to try to take my mind off of the neck pain. After about the first 5 or 6 minutes, I had to make them take me out of there. I couldn't stand it anymore. They readjusted some things, kind of gave me a little bit more support on my neck, but really there was very little improvement. But I couldn't do it at first. Once I got my mind right and got ready for it, she told me I was about a third of the way through before, so it would be about 20 minutes, and I asked her to give me kind of a countdown. So every time we went through a sequence, she would tell me, all right, we got this much left and this much left. And anyways, I got through it, and that was a week ago today, I think, or 2 weeks ago today, that I did that MRI. Got the results from that MRI and had another visit with Dr. Donner. He said, look, multi-level fusion, ACDF, that's what I do. and he pointed out that I did have kyphosis, which can be a contraindication for disc replacement. I asked, there's another doctor in his practice, in his office, that does disc replacement, Dr. Awasti. I asked to speak to him. In conversation with the support team in that office, kind of came to light that Dr. Awasti hasn't done very many disc replacements. He is on the M6 disc website as being trained on it, and he is trained on it, but you know, I was looking for somebody with a little more experience than one or two of those. So then it was on to Dr. Steck. I got all my MRI results, x-rays, and you know, I brought them with me. And Coliquia has been great. You know, I didn't want to have to drive to New Orleans. It's an hour and a half out of the way, but you know, Dr. Steck has done 10, I think he said, of these disc replacements for the M6. He said he thinks they're better, but he has no real proof, which, you know, they've only been FDA approved for 2 years now, or excuse me, a year and 6 months. So unless you were part of the FDA trials or did it outside of insurance, then you really can't get it done. So I felt confident in his ability because he seemed confident that he was capable of doing it. So that's it. He recommended a single level, like I said, because multi-level isn't covered by insurance, and I have kyphosis on the 5/6 joint, or disc. So we'll do the single level, and if in 4 or 5 years I need the 5/6 level done and there's a doctor that's willing to do it, then I'll do it then. But for now, I'm not getting a fusion. I'm getting a single disc replaced. I have no symptoms on the left side, knock on wood. Hopefully that gives me 5 or 10 more years before I have to deal with it. At that point, I'll get a fusion on that level if I got to. I'll get a disc replaced if they'll let me. I'll find somebody. Maybe I'll got to go to the Texas Back Institute where Chris Collins went. I put in a call to them, by the way, and they were my fallback plan if the local doctors couldn't do it. But I'm comfortable with Dr. Steck currently. There was some fine print in the paperwork that says the students that he teaches, the residents, may or may not be involved depending on their skill level and yada yada yada, basically saying anybody that's in that room that Dr. Steck is comfortable with can do the surgery at whatever level he's comfortable with. I was speaking with LaShawn, his PA, and she assured me that Dr. Steck would be doing all the important stuff. It would be 90% him. I don't care who gives me a scar, who closes me up, you know. I don't really care about that. I care about who's chiseling a titanium plate into my vertebra. That's the important part, and I don't want to go too far and paralyze me. So anyways, that was the questions that I asked about that. Everything else seems pretty straightforward. They gave me a prescription for some pain pills between now and then. I got to be here at dark 30 to be the first surgery of the day, and I should be leaving that day to go home. So that's good. I don't really want to stay in the hospital right now. It is July 28th of 2020, right in the middle of COVID-19 bad times here in New Orleans. So if I don't have to stay overnight, that's just better, I think. My wife has assured me that she will drive me home. I told her I would take an Uber. She didn't like that idea. But anyways, this is day 1, or the first day that I find out I'm actually going to have surgery. I got my forms over here. Apparently when you sign up for surgery, they give you these pink forms at Coliquia, and the nice lady at the checkout desk, she said, "Oh, you're having surgery," before I told her anything. And so anyways, I guess I'm excited. I've got to come in about 3 days prior for a COVID swab and some blood work and all that jazz. So I'll have to do that probably on the Thursday or Friday before the surgery on a Monday. So I think I'll do more of these videos. I hope I do more of these videos. Didn't run too long, I hope. But if you have any questions or comments, put them down there. I think that's where they go. I don't care if you like and subscribe. I don't really know what all that does. So, but anyways, if you have questions and you want to post them in the comments, if I can help someone else who's going through all this, you know, pay it forward. Again, Chris Collins, thank you for your M6-C testimonial there and all the videos you did. Just trying to keep up the information because I'm going for the M6, which is kind of the next generation from the M6-C. So anyways, thank you guys, and hopefully you hear from me soon.